So traveling for healthcare, medical tourism, it's a big thing now.
It really is.
You might picture these like super advanced surgeries, maybe recovering somewhere nicer than your local hospital.
Right.
But if you were actually going abroad for something serious, what kind of place would you really expect? It's got to be top level, hasn't it?
Absolutely. Yeah, the stakes are definitely high when you're traveling for medical care. You want the best clinical care, obviously, but you also need an environment that feels safe, comfortable, gives you confidence.
Yeah, that whole package.
It's the entire experience,
Yeah.
not just the procedure.
Exactly. And today, we're kind of pulling back the curtain on what it actually takes for hospitals and clinics to hit that mark, for medical tourism. We've been digging into this source material, a YouTube transcript actually, that spells out the specific roles and regs facilities need to follow to get accredited. It all stems back to this document from 1987, Executive Order number 120.
Yeah, and our goal here really is to unpack all these requirements. They get incredibly detailed. I mean, everything from the building, the physical space,
Right.
to staff uniforms, even how they handle the trash. It's fascinating.
So we want to see what makes a place truly ready for international patients, and maybe find some surprising details in there about quality and experience.
Let's get into it.
Okay, let's do it.
So these regulations, they start by laying down a pretty solid foundation, especially for the bigger places, the tertiary hospitals.
Right, the main hospitals.
And the key idea really is that getting accredited isn't just about ticking a box for medical skills. It's about showing excellence across the board, the whole operation, the building itself.
So maintaining high standards all the time.
Consistently.
Yeah.
Day in, day out. That's the goal.
And that starts, well, literally from the ground up. Location, building design.
Exactly. The source uses this phrase. The facility needs to be in a pleasant environment suitable for tertiary hospitals. So it's not just, is it easy to get to? It's about the surroundings actually contributing something positive.
Pleasant environment. Okay.
Yeah, think about when you arrive. The rules say the facade, the architecture, should have distinctive qualities. It's supposed to feel substantial, reputable, right from the get-go.
So it should look the part.
It should. And the area around it needs to be good for operations, make a good impression overall. That means looking at accessibility, sure, but also, are there other healthcare places nearby? What's the quality of the neighborhood like? It's the whole setting.
Huh. That's a level of detail maybe you don't think about first for a hospital, the look and the surroundings mattering that much.
And what's really interesting is how that focus on detail just carries through everything, especially into the patient's own space, their bedroom.
Ah, okay, the bedroom. This is where it starts feeling a bit like hospitality.
It really does. The rules specifically focus on private rooms and suites. And the bathrooms.
Yeah.
Not just functional. They had to be en suite, right in the room, and fitted out with highest quality fittings.
Highest quality. Okay, that's a standard.
Yeah.
And I saw something about water.
Yes. 24-hour service of hot and cold running water, specifically mentioned. And you need both showers and baths.
Not just standard plumbing then, but like constant access, regulated temperature.
Constant access. And the materials, too. Floors, walls, they have to be covered with impervious material, which makes sense for hygiene, right?
Yeah, cleanable.
But also of good design and high-quality workmanship. So practical, yes, but it also has to look good.
And the list of things in the room sounds straight out of a hotel manual. Telephone with DD and ID lines.
Meaning direct dial, local and international calls. Right from your room. Easy.
Got it. Plus, cable TV, hot and cold drinking water with glasses provided, and a fridge.
And then there's the service side, pushing that hotel feel even more. 24-hour room service.
24 hours.
Yep. And it's not just for regular meals. The regs mention snacks, light refreshments, and this is key, special diets based on what the patient needs.
Ah, so catering to different international needs, medical requirements, maybe?
Exactly. That points directly to that.
Wow. They even get into lighting and furniture, how it looks and feels.
They do. How it enhances visibility, creates visual interest, like using LED spots, and impacts the room's vibe, its atmosphere, modern feel versus, say, a warmer feel.
The amount of thought just for the patient's immediate environment, it's pretty striking.
It really is. It tells you the accreditation is about the complete experience, way beyond just the clinical side.
Okay, so that's the patient's room, their sort of sanctuary. But these rules go way beyond that room, right? To the support areas.
Oh, yeah. Let's start with where you first arrive the front office, reception.
Okay.
That area has to be staffed and operating 2004/7, around the clock.
24 hours for reception.
24 hours. Needs a well-equipped reception counter, an info counter, a separate guest relations office, and the staff there. highly trained, experienced.
And I saw something about a lounge.
Yes, a comfortable lounge area. Needs to be the right size for the facility, enough seats for patients and visitors who are waiting. They're clearly thinking about downtime, needing a pleasant spot outside the room.
Okay, this next bit sounds really surprising for a hospital setting. Convenience services.
It does, doesn't it? The regulations list things like a 24-hour porter service for luggage.
Porters. Like a hotel.
Just like a hotel. Helpful if you've traveled internationally with bags, right? And get this, a foreign exchange counter inside the hospital.
Currency exchange. In a hospital, you wouldn't see that at your local GP clinic.
Definitely not. And then easily accessible international phones on each floor. Again, reinforcing that focus on international visitors.
They've thought of security, too, like left luggage rooms, safety deposit boxes.
Yep, at reception. Directly catering to travelers who might have valuables or just need somewhere secure for their stuff while they're having procedures.
And a business center. Seriously.
Yes, with the basics, fax, computer, phone, and offering secretarial help like typing, printing, copying.
Why would they need that?
Well, it recognizes that some medical tourists, maybe business travelers, might need to keep up with work while they're recovering. It's about making their life easier, minimizing disruption.
It's like they've brainstormed everything a traveler might possibly need and layered it onto a hospital. Okay, what about housekeeping? That must be strict.
Oh, absolutely. The standard is the highest possible standards of cleanliness and hygiene. That means plenty of high-quality, spotless linen, blankets, towels, changed daily, or more often if necessary.
And laundry services.
Reliable laundry and dry cleaning have to be available too.
And the food. You mentioned special diets, but what about general dining, international and Filipino cuisine?
Correct. They need a well-equipped, well-maintained dining area or restaurant offering that mix, catering to different international tastes alongside local options.
And the kitchen itself, standards must be sky high there.
Incredibly strict. Kitchens, pantries, cold storage all need professional design and maintenance. Highest standards for cleanliness, hygiene, safety. Specifics like non-slip floors, tiled walls, good lighting, ventilation.
Wow.
Plenty of tools and utensils, nothing damaged. Diningware, silverware, well-polished, and a basic but crucial point. Staff have to wear hairnets or caps when handling food.
So, yeah, across the board. Patient room, public areas, back of house. The detail is intense. Comfort, convenience, and just meticulous hygiene.
Exactly. Creating this controlled, high-quality environment.
Okay, now let's shift gears a bit. The backbone stuff, engineering, maintenance, keeping the lights on, literally.
Yeah.
That's got to be non-negotiable in a hospital.
Absolutely critical. Patient safety, keeping things running smoothly. It's paramount. The rules say all parts of the hospital, patient rooms, operating theaters, utilities, equipment, have to be properly maintained at all times.
At all times. Why emphasize that?
Because things can go wrong fast. Equipment failure, system breakdown. It can directly impact patient care, patient safety. So maintenance has to be proactive, ongoing, catch problems before they happen.
Ventilation gets a specific mention, too.
Yes, efficient and adequate ventilation in all areas. Super important for infection control, stopping airborne germ spreading. Also for managing smells, humidity, keeping temperature stable. Especially vital in places like ORs, isolation rooms, ICUs. Good air is part of healing.
Makes sense. And lighting. Adequate lighting everywhere.
Essential. For safety preventing trips and falls. For function staff need to see what they're doing during procedures. And just for creating a comfortable environment, they talk about using both natural and artificial light, well, in hallways, rooms, ORs, waiting areas.
Okay, here's one requirement that really screams reliability.
Right.
Standby power.
Oh, this is a big one. Facilities must have a high-powered standby generator. And it needs to provide full automatic power to all service areas.
Full automatic power, meaning if the main grid goes down, the generator just kicks in instantly and keeps everything running.
Everything, instantly. Yeah. No interruption. Think about life support machines, patient monitors, surgical tools, all the essential lighting of the HVAC systems.
Wow.
It has to keep going seamlessly. It's fundamental for safety during surgeries or emergencies. Non-negotiable.
That's a serious commitment. And then there's waste disposal. I heard this was surprisingly specific.
It's incredibly granular. The source says each room shall have 3 garbage receptacles, not just in hallways or utility rooms. 3 bins in every single patient room.
3 bins in each room. What for?
Segregation. 1 for biodegradable waste, food scraps, that kind of thing. 1 for non-biodegradable general trash, and 1 specifically for infectious waste.
So anything potentially contaminated.
Exactly. Like used dressings, items with bodily fluids, It means proper sorting starts right there at the source, which is vital for stopping infection spreading, protecting the staff who handle the waste, and meeting public health rules.
And they need labels, colors?
Proper labeling and color coding are required, yes. It sounds like a tiny detail, maybe, but it really highlights how systematic the approach to safety and hygiene has to be.
Okay, moving to other general facilities. Things that help the hospital run smoothly, safely. Elevators seem like a good example.
Right. They require separate elevators for different uses. Helps manage traffic, prevents cross-contamination.
So not everyone crammed into the same lift.
No. You need a patient elevator, maybe larger, for stretchers, ensuring privacy. Then a separate one for guests and staff, avoiding congestion. And a third one, a service elevator.
For what? Supplies. Waste.
Exactly. Transporting supplies, food trolleys, linens, and, importantly, waste. Keeps that separate from patient areas and public areas. It's about efficiency, privacy, and, critically, infection control.
Makes sense. Parking adequate and secured. That seems pretty standard.
Yeah, enough spaces, clear signs. Secured means well-lit, monitored, maybe CCTV, security staff. They even mention the option for valet parking.
Valet parking at a hospital.
Could be a real help for patients with mobility problems or in an emergency. Convenience again.
And a sundries shop, like a little convenience store.
Exactly. A small shop inside the facility. For toiletries, maybe some basic over-the-counter meds, snacks, drinks. For patients, visitors, staff. Saves people having to leave for small things.
Security sounds like a constant presence.
It has to be.
Yeah.
Adequate security on a 24-hour basis at all entrances and exits. Plus, central CCTV on every floor. It's about safety, controlling who comes and goes, helping out in emergencies.
This next one feels very much aimed at the international patient, transportation services.
Yeah, the rules say things like limousine service, airport transfers, even air ambulance service shall be available upon request.
Wow. Air ambulance.
It covers the range from premium convenience for getting to and from the airport to critical transport if needed.
And the billing system needs to be computerized.
A computerized electronic billing system is required, yes. It's about being efficient and transparent. Accurate invoices, fewer errors, real-time updates, detailed breakdowns. Especially important for international patients maybe dealing with insurance or different currencies.
And they have to take credit cards.
Explicitly stated, credit card payment shall be allowed. Essential for international travelers. Need those flexible, secure options.
Clean public toilets on every floor seems basic but important.
Crucial. Easy to find, well-kept, stocked washrooms on every floor. Good hygiene, comfort, saves people having to trek long distances.
And waiting lounges, specific ones for different departments.
Yep, required in places like the ER, outpatient clinics, surgical areas. Needs to be a designated, comfortable space for patients and family while they wait. Part of that patient-centered approach.
Honestly, the level of detail for these hospitals is just immense. It's healthcare, yes, but blended with high-end hospitality, backed by really rigorous infrastructure and safety rules.
It really is.
Now, what about the smaller places? Ambulatory clinics. They can get accredited too, right? Is it the same level of detail?
It's a different scale, for sure, but a lot of the core principles are the same, just adapted. For clinics, location is still key, a comfortable and appropriate area, but here they specifically call out avoiding things like excessive noise, smoke, dust, bad odors, or flooding.
Okay, so ensuring a clean, calm, immediate environment for the clinic is vital.
Exactly. Inside, the lobby needs to be well designed. It serves multiple roles: reception, info, admitting, waiting, filling.
Like the hospital front office, but maybe combined?
Probably, depending on the size. Still needs highly qualified trained staff, enough seating for the clinic's capacity, and computerized billing is mentioned as possible here too.
And other general facilities for clinics?
Similar ideas, just scaled down. Clean, easy to find public washrooms, a secure area for medical or dental records, keeping things confidential but accessible. Enough space in doorways and corridors for people, equipment, wheelchairs maybe. Secured parking is also a must.
Any other specifics for clinics?
Yeah, they explicitly mention following national laws, like being a non-smoking facility and having provisions for people with disabilities.
Right. And the treatment rooms themselves?
Have to be well-maintained, sanitized to Department of Health standards, and importantly, equipped with modern equipment and instruments needed for safe, effective care. So keeping technology up to date is key.
Do the engineering and maintenance rules apply too, like ventilation, power?
Yes, adequate lighting and ventilation are required everywhere. And clinics also need an emergency generator.
Same as hospitals. powering everything.
Not necessarily everything. The requirement is for sufficient light in all the key areas, rooms, hallways, public spaces, and to keep critical things running, like refrigeration for medicines or vaccines, and water service if the main power goes out.
Okay, so enough to ensure safety and essential functions can continue.
Exactly. And waste management, just as strict. Same detailed segregation rules as the hospitals. The source even lists the specific bin bag colors they expect.
Really? What are they?
Black for general dry waste, green for non-infectious wet waste like food scraps, yellow for infectious or pathological waste, and then proper sharps containers for needles and such.
Wow, down to the color of the bag. And staff requirements, similar too.
Very similar. Professionally qualified, skilled, experienced. For doctors or dentists, they need their licenses from the professional bodies, plus any required specialty certifications. And smart, clean uniforms are a must.
Patient transport for clinics.
They need to have ambulance and/or transportation services available, at least during their operating hours.
Okay, so even for these ambulatory clinics, the requirements are still incredibly thorough, covering the building, the operations, staff, waste. It's definitely not just your average doctor's office aiming for this.
Not at all. It's a highly regulated setup. And these standards aren't just for getting the certificate initially. The rules are clear. Maintenance has to be on a continuing basis.
Meaning you can't just clean up for the inspectors. You have to live these standards.
That's the idea. Constant compliance, ongoing upkeep, using quality materials, and maintaining them properly over time. It's an everyday commitment.
Signage seems like a big deal too, especially thinking about international visitors.
Hugely important. Clear signs outside with the official name. And inside, lots of directional signs, visual aids, for information, finding your way around, identifying rooms, even warnings or prohibitions. Good signage is crucial when you're in an unfamiliar place, possibly dealing with a language barrier.
And these places have to show off their accreditation.
Yes, they must display the accreditation certificate somewhere prominent, somewhere visible. It's a signal of trust, of credibility, especially important for international patients choosing a facility, often from overseas.
And the whole system is backed up by inspections.
Absolutely. The authorities can inspect these facilities periodically or whenever they feel it's necessary, maybe in the public interest. Inspections should be at reasonable times.
And if they find things wrong, deficiencies,
the facility management has to fix them. They get a reasonable time frame to correct whatever issues were found.
And if they don't, or can't,
then they risk serious consequences. The accreditation certificate can be withdrawn or canceled altogether.
Which would be a major blow if you're targeting medical tourists.
Exactly. It directly impacts their business model.
There are rules about liability, too. Who's responsible?
Yes, the managers or owners are held accountable for what their employees do or fail to do. The only way out is if they can prove they were diligent in supervising staff. The phrase used is like a good father of a family. Basically, did they do everything reasonable to manage properly?
And are there specific things that can just get your accreditation canceled right away?
Yes, several grounds are listed. Things like lying or fraud to get accredited in the first place, obviously failing to keep up the standards, breaking the rules,
Makes sense.
having your main operating license canceled by the health department or local government. And this interesting one, any act against the interest of the tourism industry.
That's broad. Gives them power to protect the country's reputation.
It does. It ensures facilities act ethically and professionally, protecting the image of medical tourism there. Lastly, how does a place even start this process?
Right, the application.
They have to file an application form with the relevant government department. And they need to submit supporting documents, legal stuff, business registration papers, like articles of incorporation, SEC registration, business name certificates, depending on how they're set up.
So it's not just about saying, our doctors are great. It's a full review of the business itself.
Exactly, a holistic check. Are they a legitimate, properly structured entity ready to operate at this demanding level?
Wow. Okay, this whole deep dive, it's really shown the incredible level of detail, the sheer scope of oversight involved in accrediting a place for medical tourism. It's so much more than just good doctors and fancy machines.
It really paints a picture of regulating the entire ecosystem around the patient. The goal seems to be creating this seamless, safe, comfortable experience from the moment they arrive to the moment they leave.
Yeah, when you think about those really specific things, like the 3 trash bins in every room, or the separate elevators for patients, staff, and services requiring interpreters for different languages, or mandating options like air ambulance transport.
Right.
These aren't just random rules. They feel like very specific answers to the unique needs, the vulnerabilities, maybe the expectations of someone traveling internationally for complex medical care. It's all about reducing risk and boosting confidence.
It builds this framework where a patient can hopefully trust that the facility isn't just medically top-notch, but also run incredibly well, kept hyper-hygienic, and really focused on their comfort and safety, even outside the operating room.
So thinking about all of this, the sheer breadth and depth of these requirements, from the actual foundations of the building and how they manage waste, all the way to staff courtesy and having translators on call, it makes you wonder, what do you think is the single biggest challenge for a hospital or clinic trying to meet this standard? Is it the clinical side, the infrastructure cost, or maybe just the constant effort needed to maintain these incredibly detailed service and operational standards day after day after day? Gives you something to think about, doesn't it? The complexity behind achieving that level of excellence